Voices Together is Together for Health's ongoing series that highlights the people, places, and programs working to educate, vaccinate, screen, and treat women and girls in underserved areas around the world. Our latest installment of Voices Together features CureCervicalCancer and their Mobile Health for Mamas campaign in Migori County, Kenya.
Many Kenyan women face massive hurdles to accessing cervical cancer screening and treatment, resulting in needless loss of life and fractured families and communities. Hi, I'm Julia Cruz, CureCervicalCancer's Program Coordinator. Our Mobile Health for Mamas program brings effective and scalable cervical cancer screening technologies and safe treatment of precancerous lesions directly to communities in Kenya. We do this by training community health workers to bring self-sample human papillomavirus, or HPV, tests directly to women's homes and inviting women who are at risk of developing cervical cancer to treatment outreaches.
So in Kenya, we have so many women that are dying as a result of cervical cancer. And basically every single day, we are losing 9 women, as well as 9 lives who are lost because of cervical cancer. And over 300 women will die in a period of a month. These are women who are very key structures to the community. And once you lose a woman, of course, the community and the family structure is affected in one way or another. We have tried to do health education to create demand, to encourage these women to be able to take up their tests. One of these is through the community health promoters who are able to go to the households within the community and talk to the women, educate them, and encourage them to take a test.
Okay, I'm Monica Orera. I'm one of the healthcare providers, and I'm attached to CureCervicalCancer, Kenya, and we do a lot of screening to the women, and we really appreciate the support that CureCervicalCancer has been giving to us, and especially for the mobile clinics. It's quite important for us to embrace the mobile clinic approach because most of the women are in the hard-to-reach areas and they cannot quickly access. They cannot access the screening services in the health facilities.
Helen, on the right, has been a community health worker in Migori County, Kenya for 20 years. When she's not moving door to door to bring education and self-sample HPV testing to her neighbors, she cares for her 5 kids as a single mother and tends to her farm of fruits and vegetables. Helen is passionate about cervical cancer prevention after knowing women who have died from the disease and others who are currently suffering. She says, "I enjoy being a community health worker because I have gained more knowledge than ever before and can share what I know with the women in my community. I want women to know that screening for cervical cancer is easy and can save lives." Josephine is a 32-year-old mother of 3 and a tailor in Migori Bay, Kenya. She had previously learned about HPV after hearing about it in a hospital, but never had the opportunity to receive testing. "I wanted to test for HPV after learning about it from my local community health worker because I know it is important to protect yourself and know your status. I would tell other women to get screened because it is so easy." Mary is a mother of 4 children and has been married to her husband George for 22 years. When she's not taking care of her kids, she works harvesting sugarcane and maize fields. After women in her village died from cervical cancer, Mary wanted to be screened, but she had no access to cervical cancer screening. When one of our community health workers visited Mary's house, she learned that CureCervicalCancer was bringing free HPV self-sample testing directly to women's homes and conducting mobile treatment clinics for all women at risk of developing cervical cancer. After testing at home, Mary was found to be HPV positive, and she attended a mobile treatment outreach within 20 minutes of her home. At the outreach, she was found to have precancerous cells on her cervix and was treated on-site to prevent the development of cervical cancer.
CureCervicalCancer's groundbreaking Mobile Health for Mamas program is saving lives and preserving families and communities by meeting women where they are at. It's an innovative, scalable program that TogetHER is proud to support. To learn more about TogetHER Health's grants program and the Mobile Health for Mamas program, please visit us at togetherforhealth.org and CureCervicalCancer.org.